Did you know pancreatic cancer claims more senior lives each year than colon cancer does? And yet most people over 60 have never once been warned about its earliest warning signs. Here's what makes it even more dangerous. The symptoms actually appear months before the disease turns untreatable. Months. They're happening right now inside people sitting in their living rooms telling themselves they just need more rest, or that their back is flaring up again, or that their stomach's just been a little off lately. Right now, as you're watching this, there's a 75% chance you've already noticed at least one of these 8 symptoms and brushed it off as something unrelated. I'm Dr. William, and what I'm about to walk you through over the next few minutes is something most seniors will never hear from their own physician. Because here's the truth, nobody tells you. Pancreatic cancer doesn't have an 11% survival rate because it's untreatable. It has an 11% survival rate because it's almost always caught too late. Stick with me through all 8 symptoms, especially number 5. That one has never appeared on a single list any doctor has ever given a senior patient, but it should have been at the very top. Everything else I cover today builds toward that one. Before we dive into the symptoms, there's one thing you need to understand about why this disease is uniquely dangerous for seniors. Your pancreas can't be felt from the outside. Your doctor can't examine it during a routine visit. And your yearly blood work won't catch this cancer until it's already spread. That's not a gap in the system. That's exactly why this disease wins so often. It hides behind the very symptoms you've been chalking up to getting older. Here are the 8 warning signs it leaves behind while it's still beatable. Pay close attention to each one. Most seniors who notice their urine has darkened respond the same way. They drink more water. The color lightens for a day. They figure the issue's resolved, and they move on. That assumption is precisely what has cost people their lives. Here's what's really going on inside your body. Your pancreas sits right next to a structure called the bile duct, which carries a substance called bilirubin from your liver to your intestines. Bilirubin is responsible for the normal pale yellow color of your urine and the normal brown color of your stool. When a tumor forms in the head of the pancreas, it presses directly on this duct, compressing it, blocking it. Once that happens, bilirubin has nowhere to go. It backs up, spills into your bloodstream, and your kidneys scramble to flush it out through your urine. That's why the urine turns dark yellow, sometimes brown, sometimes resembling strong tea or cola. And here's the key detail that sets this apart from ordinary dehydration. It returns. You hydrate, it clears up. The next day, it's dark again. Because the blockage never left, the tumor never left, water can't dissolve a tumor. This symptom typically shows up before nearly every other visible sign of the disease, and most seniors dismiss it 3 or 4 times before ever mentioning it to a doctor. If your urine has been swinging between dark and normal for more than 2 weeks, no matter how much water you're drinking, that's not a hydration issue. That's a conversation to have with your doctor this week, not next month. This week. Now that you understand what dark urine is really signaling, that alone could change the outcome of your next appointment. But the next symptom is even more dangerous because your doctor has already noticed it, already labeled it, and that label is entirely wrong. They called it arthritis, a pulled muscle, an old injury flaring up, acid reflux, sometimes all 4 at once. And while you were treating the wrong problem, the real one was buying itself more time. Here's how you tell the difference. Pancreatic cancer pain has a distinct pattern. It starts as a dull, constant ache in the upper abdomen, not the lower belly, not the sides, but right below the breastbone or slightly to the left, and it doesn't stay put. It spreads, wrapping around the torso and settling into the mid-back, which patients often describe as feeling like a belt tightening around them. This happens because the pancreas is surrounded by one of the most nerve-dense regions in the entire body. As a tumor grows, it presses into those nerves and invades nearby tissue, sending pain signals radiating outward. 3 specific traits separate this from ordinary back pain. First, it worsens noticeably after eating. Not right away, but within 30 to 60 minutes. Second, it intensifies when lying flat, which is why many seniors with this symptom end up sleeping upright in a recliner or propped on several pillows without understanding why. Third, it doesn't respond the way typical pain does. You take an anti-inflammatory, use a heating pad, rest, and it returns exactly the same every time, because you're addressing the symptom, not the source. If this pattern sounds familiar, stop assuming it's your back. Tell your doctor the pain sits in your upper abdomen, radiates to your back, and worsens after meals and while lying down. Those four details together completely reshape the diagnostic path. Most seniors spend months figuring out this distinction between pancreatic pain and ordinary back pain on their own. Now you have it in under a minute. But the third symptom outranks both of these combined because it's not just being overlooked. It's actively starving your body right now, and you're watching it happen at your own dinner table every night without realizing what it means. You sit down to eat, get through 3 bites, and you're finished. You push the plate aside and tell yourself your appetite just isn't what it used to be. That's not your appetite shifting. That's a tumor physically pressing against your stomach from the outside, and your doctor has no way of knowing because you've never brought it up. Almost no one links this to cancer, not patients, not families, sometimes not even physicians. As a pancreatic tumor grows, it extends beyond the pancreas itself and presses against neighboring organs, and the stomach sits directly in front of the pancreas. When a tumor pushes against it from behind, it physically shrinks its capacity, so it fills up on a fraction of the food it once held. At the same time, the tumor interferes with the pancreas's ability to produce digestive enzymes, so food lingers in the stomach undigested far longer than normal. Your stomach stays full, your brain reads that as not hungry, and you stop eating. Once you're stopping after 3 bites because you feel full, unintentional weight loss follows, and it accelerates quickly since your body also isn't absorbing nutrients from the little you do eat. Losing more than 5% of your body weight over 2 to 3 months without trying is one of the more serious warning signs in medicine. If you've dropped 10 or 15 pounds without changing your habits, that's not good fortune. That's a red flag. Now you understand why finishing after 3 bites is never simply an appetite issue. That single insight could be the difference between catching this at stage 1 instead of stage 4 for someone watching right now. And I want to share something before we continue. In more than 20 years of treating patients, there's one symptom I've seen appear in nearly every advanced stage case I've encountered. Every patient had it. Everyone dismissed it. I'll reveal exactly what it is before we're done. But first, the next 4 symptoms are what tie everything together. And the fourth one may already be visible on you or someone you love right now. Jaundice occurs when bilirubin builds up so heavily in the bloodstream that it starts depositing into body tissue. The skin takes on a yellow cast, the whites of the eyes turn yellow, and in seniors with darker skin tones, it often shows up most clearly in the eyes and palms. But there's another piece of this almost no one warns you about. Intense, body-wide itching with no rash, no clear cause, and no relief from lotion or antihistamines. This happens because bilirubin settling in the skin directly irritates nerve endings. It's relentless and won't let up until the root cause is addressed. Here's what makes jaundice particularly tricky in seniors. It looks identical to jaundice caused by gallstones. Same yellow tint, same dark urine, same itching. And because gallstones are so common in people over 60, this is exactly where misdiagnosis tends to happen. A doctor spots the jaundice, suspects gallstones, orders basic tests, and the deeper workup gets postponed. Weeks go by, sometimes months. That's why you can't simply walk into your doctor's office and say, "I look yellow." You need to present the full picture: dark urine, upper abdominal pain radiating to the back, feeling full after barely eating, and now yellowing skin or eyes. Together, that combination tells an entirely different story. Don't let any one symptom be evaluated on its own. Subscribe now if you haven't already, and stay with me, because symptom 5 is the one that has sent seniors to the emergency room in a life-threatening crisis before any doctor ever connected it back to the pancreas. This one has a body count. I want you to think about whether you or someone you know has developed a blood clot recently with no clear explanation, no recent surgery, no long flight, nothing anyone could pinpoint. Because what I'm about to explain changes everything about what that clot may have actually meant. Pancreatic cancer releases specific proteins into the bloodstream that alter how blood behaves, making it abnormally prone to clotting in places it shouldn't. This most often shows up in the deep veins of the legs. The calf or thigh swells, feels warm, and produces a dull, heavy ache that doesn't ease with elevation or rest. Here's where it turns life-threatening. A fragment of that clot can break loose at any moment and travel to the lungs. Sudden breathlessness, sharp chest pain that worsens with inhalation, a heart rate that spikes out of nowhere. If those three symptoms occur together, call 911 immediately. Not your doctor, not urgent care, 911. Studies have found that in a notable share of pancreatic cancer cases, an unexplained blood clot was the very first warning sign, sometimes appearing up to 6 months before the cancer was diagnosed. 6 months. That's how much earlier this could have been caught if someone had linked the clot back to the pancreas. If you've had an unexplained clot recently, ask your doctor directly whether abdominal imaging should be considered. Not out of panic, but as a responsible next step that could change everything. You now know something most ER physicians don't think to mention to their senior patients, and that connection between a blood clot and the pancreas is exactly the kind of information that saves lives. The sixth symptom is one your body has likely already been signaling on a repeating cycle every few days, like clockwork. And each time, you've probably given it the wrong explanation. Maybe you ran a fever last Tuesday, it broke, then came back Thursday, and you assumed it was some bug going around. It wasn't a bug. A bug runs its course and ends. This keeps returning because your immune system isn't fighting off an infection it can beat. It's responding to something that isn't going anywhere. Pancreatic cancer generates ongoing inflammation throughout the body. The pancreas is inflamed, the bile duct is obstructed, bile is leaking into places it doesn't belong, and your immune system is reacting to all of it at once. The result is a recurring pattern of low-grade fevers that come and go without ever fully clearing. It's rarely a dramatic high fever. Instead, you get episodes of sudden, bone-deep chills, even in a warm room, shivering that comes out of nowhere. And then within hours, your temperature creeps up slightly, maybe 99 or 100 degrees Fahrenheit. Not enough to feel truly ill, but enough to feel persistently off. Then it fades. Then it comes back a few days later. Then it fades again. This cycling, paired with night sweats, waking up damp without having felt hot beforehand, is a combination that should prompt further investigation right away. A fever that keeps returning for weeks with no infection identified isn't a fever problem. It calls for imaging, not another prescription. Now you know the difference between a recurring bug and a recurring warning sign, and that distinction is what leads to the right test instead of the wrong medication. The seventh symptom accelerates everything else on this list, because while you've been calling it tiredness, it's been quietly breaking your body down hour by hour. You slept 9 hours and still woke up drained, assuming it was just a bad night's sleep. It isn't. Your body is being drained of fuel every hour by cancer cells that are biologically wired to intercept everything your healthy cells need before those cells ever get a chance at it. Ordinary tiredness has an identifiable cause: poor sleep, a demanding day, stress, and a fix: rest. Cancer-related fatigue doesn't resolve that way. You sleep 8 hours and wake up as though you didn't sleep at all. You rest all afternoon and stand up feeling just as heavy as before. Simple tasks that never used to be an issue, walking to the mailbox, carrying in groceries, climbing a single flight of stairs, suddenly demand effort wildly disproportionate to the task. Pancreatic cancer cells compete directly with healthy cells for glucose and nutrients, intercepting the fuel your organs, muscles, and brain are trying to draw on. Your body runs on a deficit every hour of every day, and no amount of sleep can make up for fuel being siphoned off before it even arrives. The result is an exhaustion that feels categorically different: heavier, more total, unresponsive to rest. If that matches what you've felt for the past several weeks, it deserves investigation, not resignation. And the eighth symptom is the one I mentioned earlier, the one I've seen in nearly every advanced stage patient I've treated, the one that shows up in the bathroom, the one nobody talks about. Here it is. Your pancreas produces enzymes designed to break down fat. When a tumor blocks the pancreatic duct, those enzymes can't reach the small intestine. So the fat you eat passes through your system almost entirely undigested. And undigested fat changes your stool in specific, recognizable ways. It turns pale, sometimes gray or clay-colored instead of brown. It becomes greasy, with a visible, oily sheen. It floats instead of sinking due to the fat content, and it carries a smell distinctly more foul than usual. This isn't something you ate. It's a direct mechanical sign that a tumor is interfering with your pancreas's function. Alongside it, you may notice nausea, particularly after fatty or rich meals, occasional vomiting, and a general heaviness or discomfort after eating. And because your body isn't absorbing fat properly, it's also missing out on the vitamins that depend on it, which accelerates the weight loss, the fatigue, all of it. Pale, greasy, floating, foul-smelling stool that lasts more than 2 weeks warrants a call to your doctor within 24 hours, not next week, tomorrow, now. Before you close this video, give me 60 more seconds, because what you do in the next 24 hours may be the single factor separating catching this early from not catching it at all. If you recognized even 2 of these 8 symptoms while watching, your next move is the most important health decision you'll make this year. Pancreatic cancer isn't a death sentence when caught early. The outcomes for stage 1 are worlds apart from stage 4, almost unrecognizably so. The only thing separating those outcomes is what someone did in the weeks after their body first started signaling trouble. Most people waited. Most people chalked it up to age. Most of those people aren't here anymore to tell you that was the wrong call. You're still inside that window, but it won't stay open forever. So here's exactly what to do. Write down every symptom you recognized while watching this. What it is, when it started, how often it occurs, whether it's worsening. Then call your doctor and read that list aloud, word for word. Don't summarize it. Don't just say you've been feeling off. Read the specifics. Specific symptoms prompt specific tests. Vague complaints get sent home empty-handed. And if your doctor brushes off your concerns without ordering imaging, you're entitled to push back. Ask directly whether a CT scan or abdominal ultrasound makes sense. You're not being difficult. You're the only person in that room fighting for your own life. Don't walk out of this video and go back to blaming it on age. You know too much now for that. If this video told you something your own doctor never has, hit like right now. It takes 1 second, and it puts this in front of another senior who needs it just as urgently as you did before you clicked play. Subscribe if you haven't already. Every week, I break down the health information that isn't making headlines but is quietly changing outcomes for people over 60. And share this tonight with someone whose back has been bothering them or who keeps insisting they're fine. You might think you're just sending a video. You might actually be handing them a window they didn't know they had. Now, there's something I left out of this video on purpose, something that deserves its own conversation. There's a specific combination of just 3 of these 8 symptoms that, when they show up together, doesn't just suggest pancreatic cancer, it nearly confirms it. And there's a single test your doctor can order tomorrow that can catch this combination before it reaches stage 2. Most seniors have never heard of it. Most doctors won't mention it unless you ask by name. That's what the next video covers. It's on your screen right now. Watch it before you do anything else.